Thank you. For those of the participants who may drop off because network is not always stable in Ghana, the light may probably even go off whilst we are on the program. So we'll record this so that we share later on. Okay. So, Sister Agnes, Amoah-Koi. Near the kind, so you're Ghana, you are Ghanaian?
Yes,
from where?
Pachomi free latte, equipment latte.
Hey, where you Bali?
Bali.
Yeah, so the lattes are the ones.
Yes.
I also come from a Piapin or Bosumasi.
Oh, okay.
Yes.
Yeah. Okay.
I say my maternal grandparents come from Dewu.
Oh, okay. Wow.
This is also another one state.
One, yes.
Yes.
Yeah. Oh, okay.
Yes.
I see.
So, in Ghana, okay, so how long have you been away from Ghana?
I've been away for 25 years.
Oh my God.
Yes.
And where did you start off in Ghana? Where did you go to school? Those basic things.
Yeah, I was, as I said, I came from Latte-Kuyapem. Okay. And so I went to Presby Primary at Latte. And then I went to Presby Middle, known as Salem.
Yes, I remember Salem, yes.
Yes, at Latte.
Okay.
Then when I got to middle school, Form 2, I did a common entrance and I went to Benkum Secondary School. Okay. Yes, so I completed the GC and everything in 1981.
Wow.
Yes, so after the completion, my parents said, oh, just go and do nursing. I said, no, I don't want to be a nurse. I'm scared of dead bodies. I'm this. So I didn't want to be a nurse. So I stayed home for 1 year. Oh. And then later I realized that, no, I have to do something. So I went to the training college. I did the entrance exams to training college. And so I went to Presby Training College.
Okay.
Yes.
I see.
Yeah. I went there from 1982 to 1985.
Okay.
I graduated as a 3-year post-sec teacher.
Proper trained teacher.
Yes, yeah. And then I went to my first station, I taught at Akwetia Presby Primary School.
Oh, okay.
In the eastern region.
In the region. That is Akwetia is on the mountain.
It's no, it's in the eastern region. It's the Diamond, the Diamond
City. Okay, yes.
Yes, Diamond City, yes.
Okay. All right.
I taught there for 2 years. Then I got married and my husband was in Accra.
Okay.
And so I got transferred to Accra as a teacher. So when I came to Accra, I started teaching. My first station was at Osu. The school is called Tenashi 1. Yeah, I taught there for 1 year. Then I transferred to Teshi 7 Junior Secondary School. When you are entering Teshi from the Air Force or the barracks area, the cluster of schools on the right side. Okay. Yeah, the last school is called Teshi 7. Okay. So I taught at that place for about 10 years.
Oh, okay.
Yes, so in all, I taught in Ghana for 12 good years. Then my husband won a lottery. Okay. Yes, so I have to come with, there's one Gertrude Eshon. She says she can't hear anything.
Okay, kindly hold on. ladies and gentlemen, can anybody hear me? Can you hear us?
Yes, I can hear you loud and clear.
Yes, we can hear you.
Yes, sir.
Yes, we
We
can
can hear
hear
you. We can
you.
hear you.
Hello.
Okay.
All right.
Thank you all. Thank you.
Okay, so Gertrude, and then I think earlier on somebody also posted they cannot hear us. So
Yeah.
Gertrude, and then 1 second. Felicia, please check your microphones. Everything looks good here. Sorry, Sister Agnes, go on.
No
So
problem. Yeah.
You taught
And
12
so-
years in Ghana.
Yes, I was a teacher for 12 years in Ghana. And then I came to US here with my husband and my 3 kids.
Okay.
And so when I first got here, I work as a housekeeper in a hotel.
Okay.
For about 3 months. Then I met somebody there who introduced me to certified nursing assistant.
CNA.
CNA.
Okay.
So I registered for the CNA class and I did it within 3 months. Whilst I was working as a housekeeper, every Saturday I would take the class, Saturdays and Sundays. I was taking the classes.
Okay.
For 3 months. So I eventually passed and I got my my certified nursing assistant certificate, and I did the state board exams and I passed.
Okay. So this state board exams is in Illinois state.
Yes, please. Yeah, it's in Illinois state.
Okay.
So after that, I left the housekeeping and I started working as a nursing assistant, yes.
Okay.
But I was working at the hospital. And then I went to school, taking some prerequisites for nursing.
Okay.
And so as I was doing the prerequisites in the community college, I realized that my kids are growing. My kids are also going to the university. And I look at my age and I said, no, I have to help these kids. I don't have to compete with them. So after I did all my prerequisites, I went straight to do the licensed practical nursing, LPN program. So I did the LPN program and I passed.
Okay.
And then I worked in one nursing home for 1 year. And after that, I came to Wesley Place.
Oh.
Yeah, so when I came here, Rose hired me immediately. When she met me, she said, what is your profession? I said, I used to be a teacher. She said, I could see something in you. I could see that you'll be a great nurse. And so I will hire you. So I was hired as a nurse.
I see.
And so I have been here for the past 16 years, 2006 up till now.
With Wesley Place.
With Wesley Place, yes.
Okay, just 1 second. When we say Wesley Place, we are talking about Chicago Methodist Senior Services.
Yes, the Chicago Senior Methodist Services, under it we have Wesley. We have other facilities.
That's right.
And Wesley Place is one of them.
Okay.
We have the Hartwell. Recently, we have another facility, they say Bellwood.
Okay.
Yeah, so it's different Covenant Home, and they are all under United Senior Methodist. So one of them is Wesley Place.
Okay.
And this is where I am.
I thank God. So since you said you joined Wesley Place, which year?
2006.
2006. Since then, you have been with Wesley Place. And,
yes, please.
And so you were still an LPN at Wesley Place?
Yes.
Okay. Now, but you started as a CNA, right?
Yes.
Okay. Now, today we have one person who has gone through both CNA and LPN. And my students keep asking these questions. Although I ask them to read, I am sure they are going to ask us again. What is the job of the CNA and what is the job of the LPN, especially the differences between the two?
Okay, so as a certified nursing assistant, you come in to the unit, your job is to take care of the patient. Like when you come in to dress the patient, to feed the patient, to give a shower, to clean the patient, it is the job of the certified nursing assistant.
Okay.
You check vital signs too, it is your job.
Okay.
To do it. To change their beds.
Yeah.
It is your job. To check whether the patient need water. Is she okay? It's like it is your job to take care of them in the facility, whether at the hospital or in the nursing home. That is what you do. Okay, is that okay?
Yes, it's better.
Okay, but the nurse on the floor, as a certified nursing as an LPN, you give medications. You can also do, we also do all these jobs. Because before you become a nurse, you've been trained as a certified nursing assistant.
Okay.
So whatever they are doing, you should also be able to do it. And so we do it too. We help them, we clean the patients, we feed them, we change their clothes, especially when they need help. It's like when they are short, you have to help. But not only when they are short, but even still as a nurse on the floor, you need to participate in helping them, in feeding them, in changing them, in everything, because you have been trained as a certified nursing assistant, so you know the job. And so you have to do it to help them.
Okay, I see.
And
I suspect the salary for the two are totally different.
Totally different. Totally different. Yes. It's a big difference.
It's a big difference.
Yes. So you have to work your way higher.
Yeah.
You don't have to stay as a CNA, you have to work your way higher. Yes.
Okay.
Yes.
So as LPN, what is your typical day like?
Okay. My typical day is coming in, getting a report from the night nurse, checking my patients to make sure everybody is okay, giving them their medications. If there's a lab to be done, you call the lab, you get the results, you relate to the doctor. So you are the mediator between the doctor and the family. You are, yes, you are in the middle between the family and the doctor. Concerning the well-being of the patient, you are in charge of making sure that the patient is okay.
Okay. And do you do overtime? So you don't do night duties?
I don't do night. I do morning most of the time because I'm a grandma, so I don't do. I have about 3 grandkids, so I'm very busy at home. So, and so I don't do night shift. Yeah, but there is a night shift here too.
Yes. Okay. And as an LPN, you can give medication.
Yes.
You can pass IV lines.
Yes, and I will tell you the difference between an LPN and a registered nurse. So as an LPN, you can start the IV, you hang it.
Okay.
You hang it, you start the IV, but you don't like when there is an order for IV to be started, the RN needs to start the site, like need to prick and start the site, and then you as a nurse, you just hang it. It's your job to hang it.
Okay.
Yes, but you don't start the IV, but you hang it.
Okay. I see.
That is the only difference between LPN and RN.
RN. Okay.
Yes. Apart from that, we do everything that RNs do.
Okay.
Yes.
I see. Now, working with Rose and Chicago Methodist, the last 16 years plus, how is it like?
Oh my God, I want to carry her on my back. She's our mother. She is a very nice woman. She is a mother. She understands every situation. Even before you open your mouth and talk, she knows. So she understands everything. She's a good woman. She encourages everybody to grow. No matter, she knows that people have their weak points and everything, but she will encourage you. She will guide you. She doesn't make you feel hopeless. She doesn't make you lose hope that you've come to another country or anything. She's always ready to listen. Always ready to listen. She has a big heart.
Yeah.
She is indeed a mother to us all.
Okay.
Yes.
And then what about United Methodist as a whole?
A good leader, a honest leader. And what else can I say? I can say all the good things that I have to say about my mother. Yes. That is who good Rose is. She's a patient woman. She has that patience to tolerate everything. It's just that she will guide you and lead you. So she's a good leader.
Thank you for that. United Methodist, I have come across Bill Dahl. Is it Bill Dahl?
Bill Lowe, the president.
Lowe. Yes, the president, the CEO.
Yes.
Bill Lowe. Paul, a couple of the guys based there. And one thing I like about them, they are very humble. You know,
very humble. Yes.
They talk to the president, and he doesn't make you feel he's your boss. You know, he make you feel, yes, I want to listen to you. Come up with ideas. I want to hear from you. I want to, I want to share ideas with you. Yes,
yes. And you know what makes me feel like I'm part of this family? It's like when yesterday I just stepped out, I was going home. I've been here for a long time, people come in and go, but this president still knows me. Like, he saw me, he said, "Hi, Agnes, how are you?" "Oh, nice to see you again. You brought, they hired my niece here." I didn't even know that he knows it's my niece. He said, "Oh, we love your niece. She's hardworking." You know, he makes you feel like you are really part of the family.
That's right.
Yeah, somebody will just ignore you, will not talk to you, but this, Bill, Paul, everybody here makes you feel like you are indeed part of the family. Yeah, so you don't even want to leave because you are part of the family. So where are you going? This is my home. I tell everybody, this is my home. Yes.
Right. And so United Methodist, if somebody who had not been there before wants you to paint a mental picture, how is the place like? How many patients? What type of patients? Not the illness they present with. That would be to break ethical rules. But in general terms, broadly speaking.
Yeah, we have 4 units. Plus the 5th unit is a library. So the first and the second unit, we take skilled patients from the hospital.
Okay.
Let's say they are sick, surgery. Some of them have surgery. They come here for rehab. They can't walk. So when they come here, the physical therapists need to work with them and make sure they are able to walk.
Okay.
So the first and the second floor is for skilled patients.
Okay.
Or Medicare. They help them to walk, to be able to go back home.
Okay.
Yes, so that is the goal with the first and the second floor. 3rd floor, we call it dementia unit.
Okay.
But the dementia unit is 2 floors, 3rd and 4th floor. The 3rd floor is mild dementia. And so the residents are more a little alert than the 4th floor.
Yes.
So when the dementia progresses, then they bring them to the 4th floor.
Okay.
And this is where I am.
Oh, I see.
The 4th floor is my unit, yes. And
I
so these are the different units. And it can take up to about 100 patients.
Oh, okay.
Yes, it can take up to 100 patients. But on the 4th floor, this is their permanent home.
Okay.
Because the dementia has progressed. And so they live here with us.
Okay.
Yes, and we live here with them. So we know them really, really well. You know the behavior, you know how to control the behavior, you know how to make her feel at home, you know how to make her feel like, okay, I'm with her family. And that is the 4th floor. That is where I am. And this is where Grace also works.
Okay.
Yes.
Oh, so you know Grace?
Oh, I work with Grace
Okay.
over here. Grace works in the afternoon and I work morning. So I was here when I was a nurse, Grace was a CNA here.
Oh, I see.
Yes.
Okay. All right. And broadly speaking, how's the salary like? How's the working condition like? If you have been able to work, Grace said she's worked there 20 years.
Yes.
If you have also worked there 16 years,
yes,
it must be a place with good working condition to keep you there permanently.
Yes.
Now. So can you describe how the working condition is like?
Yeah, I mean, we don't discuss salaries among us here, but being a CNA, I have people who are, when I came here, they are here, they were here and they are still here.
Okay.
People are ready to retire here.
Okay.
But there are other places. So if the pay is not good, or if there is not good working condition, I don't think they will stay here up till now. Yes. I met a few CNAs that when I came, they were here, they've been here for over 20 years and they are still here.
Okay.
Yes. And so it's not that bad. I mean, it's not like, I won't say I know how much, but I think everybody is satisfied.
Yeah.
Because if you're not satisfied, there are other places you can go.
Okay.
Yes, but people are still here. And I'm still here too. And I know other nurses. I went to school with other nurses, so I know places that they work. But it is good.
I see.
And they have insurance too. Good insurance here.
Okay.
Yes. And they have I'm sorry.
Yeah, go ahead. 401.
Okay. Yeah,
benefits,
we call it, they have 403B here.
Yeah.
Long-term savings. And there are other good conditions here that when you come in, they will let you know and you will love it.
All right. Now, thank you for that. One of the concerns of Ghanaians, you have been here before. Nurses for Ghana, doctors for Ghana, they break their backs in very, very difficult working conditions. I have a doctor who is a ENT surgeon. I came across him, Dr. Mauto, with Confanochi. She did my mother's tracheostomy for her. And on that day, I noticed this doctor was up from morning till around 8 p.m. Performing surgeries without break. Do you have a similar situation there?
No. I mean, when you are tired, sometimes the floor, even where I'm working, it becomes so stressful. But Rose always say, and my DON and my bosses always say, when you feel like it's too much, you are overwhelmed, call me, let me know. Sometimes you have to get off some time, get fresh air. When it's too much for you, you have to open up and say, no, I think I need help. Yes, because you can easily make a mistake.
Yes.
And over here, this is your license. Your license is your license, so you have to voice out.
Yeah.
It is so stressful now, I need help. Somebody will step in and they will give you a break.
Okay.
Yes. Okay. So that stressfulness is not like that. It's under relax. You work, relax. When I say relax, you know, I was in Ghana. So let me say this. Let me cut in. When I was in Ghana as a teacher, when it rains, I don't go to school. I would just, there's a student behind I said, when you go tell Mr. Kukuba that I'm not coming today. You know, it's like, oh, everything is relaxed. But when I came here, I found out, no, there's difference. You got to work.
Yes.
So yes, when I say relax, it's not like you take things for granted and stay home. You work, but when you are so stressed, you got to voice out.
Yeah.
And somebody comes in to relieve you immediately. We don't do it like that here. No.
Okay. Now, I know there are other nationals, other country nurses working with United Methodist.
Yes.
Do you see other nurses from other countries?
Yes, the Filipinos, the Philippines. Okay. Yeah, those from the Philippines, they are here. Almost all of them in this building because they were being recruited too.
Okay.
Yeah, so as a matter of fact, when we talk about nurses here, 80% of them are from the Philippines.
I see.
Yeah. Yeah, so when they come in, we train them here, we work with them, and we train them here.
Okay.
Yes.
And then you currently, what about nationals from other African countries like Nigerians?
Yes, the Nigerians are here.
Okay.
The Jamaicans are here.
Okay.
We have people from Nigeria, we have people from Jamaica, we have people from Cameroon.
Oh.
Yes, Cameroonians are here.
Okay.
Yes.
That's nice.
Yeah,
and,
different nationalities, yes. We even have Spanish, Mexicans, they are here.
Oh.
Yes,
Okay.
yes.
But majority of them are Filipinos because Rose recruited a lot of Filipinos.
Yeah, so thank God that Rose went to Ghana now. So yeah, now the light is on Ghana and we are so happy.
She has recruited a lot of Filipinos the last 18 plus 20 years. Okay.
Yes.
All right. So Agnes, there was a power being any. I don't know if folks, do you hear Sister Agnes? Does anybody have a question, a comment, and concern, something to ask? Maybe I forgot to ask a question. You just unmute your mic or raise your hand first so that we have some order here. Yes, Rosemary Amoah. Rosemary, unmute your mic and ask your question or speak.
Mr. David, good afternoon.
Good afternoon, Rosemary. How are you?
Please, I'm fine, and you?
Fine, thank you.
Okay. I want to ask. She was saying that there is a clear difference between the CNA and the LNP or something like that.
Yes,
Can I
ask?
LPN.
Yes. Can I ask for the pay for the CNA there?
The pay for the CNA. Okay.
Yeah.
We have addressed this before.
Yeah.
For the CNA, okay, so we have three categories. We have the caregivers, we have the CNA, we have the RNs. It's for the caregivers is $15 to $18 per hour, or 18.5. CNA is $20 to $25 per hour, and then the RN is $30 to $40 per hour. I don't know for the LPN, but the LPN.
Okay, thank you very much.
The LPN salary will be different from that of the RN.
Okay. Okay. And okay, thank you. This one you have answered him already, so there's no need. Thank you, Mr. David.
You're most welcome, Rosemary.
So Monday.
Okay. No. We have a meeting tomorrow at 6 p.m.
Oh, okay. Okay.
Now,
Okay.
Rita, Ade, your hand is up. Rita, Ade, you have to unmute your mic. We can't hear you. Rosemary, please mute your microphone. Thank you. Rita has dropped her hand.
Yeah, Mark's hand is up.
Mark, your hand is up.
Hello, Director.
Go ahead.
Hello, Director. Good afternoon. Hello, good afternoon.
Mark, go ahead. Ask your question. We can hear you.
Yes. What is challenge when you are transitioning from a teacher to a CNA? Hello.
Hello. Can you hear me?
I want to find. Yes, I can hear you now.
Okay.
Mark, go ahead and ask your question.
Yeah, my question is that what is her practical challenge when she was transitioning from a CNA?
I don't know what I
Mark,
did. I lost.
sorry, we cannot hear you. We can hardly hear you. Please send your question on the chat page. Okay. The next person is Rita. Rita, you are back. Rita, please unmute your microphone and ask your question. Hello, Rita Ade. Please unmute your microphone and ask your question.
Maybe she can get it. She can't hear.
Okay. Esther Lamte Mills. Hello, Esther.
Somebody said meaning of LPN. David, let me explain it.
Okay.
It's licensed practical nurse. Licensed practical nurse. And RN is registered nursing. You still have to go to school. Like I was saying, the difference is just a little. It's just a little difference. The RNs, they have to take 3 years program, and the LPN is 18 months to 2 years. So that is it. And when you get to the field, the only difference is LPNs don't start an IV. You give injection. When it comes to injection, you give injection. The IV, you hang it.
Okay.
You hang the IV. You just don't start it, but you hang the IV. You give injection, IM injection, you give. All the injections you give, insulin, everything, you do it.
Okay.
You are the nurse on the floor, so you do everything. The only thing is the IV. So when it comes to IV, you call somebody to come and start it for you, and then you hang it.
Okay.
So that is the only difference.
All right.
Okay, I see a lot of hands up. Yeah.
Yes. So Esther, can you hear me now? Esther Lamte Mills. Oh, okay. Ibrahim Seidu.
All their microphones are off. It's like they are muted.
Sir, can you hear me?
Yes,
Yeah.
I can hear you, Ibrahim. Go ahead.
So I want to find out, like, if you are a senior and you are transitioning to become an RN, when you go to school, how many years are you going to be in the school for the training?
It will take a maximum of 3 years. It depends on you. It depends on you and your family. But if you are like, I need to focus, that's what I want to do and get out. 3 years, you should be done. Take your state board and be an RN.
Okay.
But you know, sometimes responsibilities come in. Maybe your wife is there, your kids are there, so you take your time and go. So you can take 4 years, you can take 5 years. But if you really need to focus, 3 years, you can do your prerequisites, enter the nursing program, and get out and be a nurse. Have I answered the question?
Seidu, is your question answered?
Yes, it's answered, sir.
All right.
Hello, sir.
Yes, Rita, I can hear you now.
First, I wasn't able to mute my microphone. That is why.
All right.
I wanted to ask whether, like, I am coming there as a CNA, but I'm a nurse in Ghana here. How am I going to transform my certificate to become LPN there?
Okay.
Thank you.
You're welcome, Rita.
What was her question again?
So she's a CNA. When she arrives, she'll start working as CNA. She's wondering how she can then progress to become an LPN.
Yeah, as a CNA, the same process. You come in, you start working, you take classes, you pass, you enter the program.
Yeah.
And then, so you can take 2 years to become an LPN. But like I'm saying, in this country, classes it's not like straight, I failed, I'm out. You can always take classes like, okay, this semester I'm registering for a class. The next semester, I'm not going to register. I need to take my time, you know? So it depends on you.
Yeah.
You can always make it here. It depends on you.
All right. Okay, so somebody...
No, hello, sir.
Yes, Rita.
My question was, I am a nurse, like I'm a midwife in Ghana here. So meaning I have a nursing background already. So if I'm there, like I want to evaluate my certificate here so that it will be equivalent to that of LPN over there. Like how am I? Is it possible? That was my question.
Oh,
I don't know whether you understand what
I understand. You want to evaluate your certificates before you get here.
No, like if I'm there, I'm coming there as an CND. But I'm a midwife, I'm a trained midwife in Ghana. So if like I wanted to evaluate the certificate so that I become LPN over there, or RN, how am I going to? Is there any possibility for me? Or I have to do another course?
When you get here, when you are here, they will direct you. There are evaluation boards. We have evaluation centers in this country. Some of the Filipinos that come in that I know, they come here and do the state board again. Others take it over there before they come here. So there are boards here that will direct you. You can do it here, or you can evaluate it when you get here. You can evaluate but there are evaluation boards, which I'm not aware. I don't know the evaluation boards for nursing, but I know there is a way out.
Okay, let me probably help here. So there is an evaluation equivalency board for nurses. There are a number of them. The popular one is called CGFNS, but the popular in our part of the world, CGFNS. They do credential evaluation to do equivalency and see which one you have. But for the last how many years they have operated, nurses from Ghana, you are evaluated, and then you get the equivalencies, but when you get to the state, you still, I mean, eventually you still have to write
As for the state board, yes, you also do it here. Yes.
For you to work as an RN. Now, that is totally different from midwives. Now, there's no midwifery practice in the US.
Yes.
So you go as a midwife, you cannot do any evaluation or equivalency of your certificate for you to practice as an RN. You need to go through the system and write the state board exams, go for classes, write the state board exams so that you can get your license to practice. Rita, is that clear?
Yes. That's what I wanted to know.
So for nurses, yes, you can do credential evaluations. But for midwives, it's a totally different ballgame because there are no midwifery practice. CGFNS doesn't even do the equivalency evaluation for midwives because there are no midwives in the US. All right. There are a couple of questions in the chat box. Let me see if I can read some of them. Please, can someone at age 50 be recruited to work with United Methodist? Yes, you can be recruited to work.
Yes.
You can be recruited to work.
You can be recruited to work, yes.
But when you hit the retirement age, then that becomes a problem. Then Simon wanted the meaning of LPN. I think she has explained that, licensed practical nurse. When you start your training as CNA, one of the things you're going to learn is the difference between LPN, CNA, LPN, licensed vocational nurse,
nurse, yes.
And so on. You're going to learn all those. Kwegu asked, can we talk? Yes, Kwegu, you can talk. If you have something to say, please go ahead and say it. Then, okay, he said, okay, thank you. Please, I want to know if you give steady leave. Okay, now steady leave has a totally different meaning in the US. Okay, but whilst you are working, you can go for classes, you can go for further studies, but you don't have a system where you break 3-4 years, you are going to school, when you finish, you come to work. No,
and they will pay you, no.
But whilst working, you will have time to go for further studies.
To school, yes.
Then Rosemary says, my hand is up again. Oh, okay. Rosemary, 1 second. Let me finish reading these questions. I'll come back to you, Rosemary. Then Ruth says, please, can a CNA takes RN course to become an RN instead of going through CNA, LPN before reaching RN? Oh, yes.
Of course. Yes. Of course. Yes.
Under our program, the arrangement is all CNAs. When you reach the US, we will prepare you to write the NCLEX in the United States. In fact, you will notice that there are a lot more of you doing CNA than the NCLEX because of the challenge of sending you, the NCLEX applicants, to South Africa, the whole of Africa. The only place where you can do the RN exams, the NCLEX, is in South Africa or in India. It is a rigorous program. We want you to go to the US with your CNA. Once you arrive, we'll prepare you there to write your NCLEX and become an RN there. So Ruth, I hope I have answered your question. Then Richardson said, thank you, sir. Exactly what I knew. Okay. Esther says, please, my question is it possible to register and take your CNA exams here in Ghana before you transition to the US? Esther, that's exactly what we are doing. Okay, that's exactly what we are doing. So if you have not started yet, please start now. Then Nana Ejewa says, please, is this recruitment meant for only nurses and midwives, please? Oh, no. we are recruiting even non-nurses. So all professions, physician assistants, dietitian, teachers, marketers, doctors. Okay, so it is open to everybody, irrespective of your academic background. Then Obrempon says, please, I want to find out the fate of physician assistant. How can one join your program? Oh, there are a number of physician assistants currently on the program. I'm actually looking at one right now. I don't have their permission to mention their names, but there are physician assistants on the program. So yes, physician assistants, there are medical doctors, there are all kinds of people with all kinds of academic backgrounds. All right, Rose, please ask your question again if you have. Rosemary.
Okay, Mr. David, I wanted to ask that as a CNA, I'm a midwife and I'm doing CNA. If I get there and I have learned here on my own to write the NCLEX, do I still need to go for the classes there before I can register for the NCLEX?
Okay, so Rosemary, that is a hypothetical question you're asking. Let me tell you what is really happening on the ground.
Hypothetical question.
Yes, let me help you understand what is really happening on the ground. And those who have attempted the NCLEX will tell you. The NCLEX exams has become even harder with the introduction of NCLEX next generation. It started this April 2023. NCLEX is now NCLEX next generation. And therefore, trust me, when you get to the US, it is important you do further training for you to be in a position to write the NCLEX and pass. But like I said, when you get there, we'll take care of that for you.
Okay, thank you, Mr. David.
Most welcome, Rosemary. Ibrahim, is your hand still up or your question has been answered? Okay, I believe his question has answered. Edward Usu and San, faculty, Usu and San, your hand is up. Hello, you need to raise your voice, sir.
I hope you can hear me now.
Yes.
Okay. Please, my question is, what are some of the challenges?
Sorry?
Okay.
Mr. David, can I continue?
Please speak up, man.
Okay. I'm asking, what are some of the challenges that the teaching some of the patients can see the
Edward, your line is bad. We can hardly hear you. We cannot hear you, please. If you don't mind, please put your question in the chat box. Esther Lamte Mills is back. Please, can you go with your family or you need to go first before they join you? Okay. Our program is that when you have a family, we petition for you, your legally married spouse, and all your children. But for when everything is set for you to leave, the applicant will first go for the first 2 months. You go to live in free accommodation.
Yeah.
Yes. Agnes is nodding in confirmation of that.
Yes, yes. The accommodation is all around. We have buildings around.
Okay. So you live there for the first 2 months.
First 2 months, yes.
Training, you go through orientation, you are assisted to do your social security, and so on and so forth. Then after the 2 months, you will now be properly placed with either, there's a network of facilities in the United Methodist umbrella. So then we place you permanently. It's after the placement, of course, after the 2 months. During that 2 months, you'll be working, you'll be making your money. But then then you have enough money, you rent your own apartment, you move out from the free accommodation. We help you then now send your family to join you. So the first 2 months you go alone. The applicant go alone. After that, your family comes to join you. So I hope I've answered your question. Now I have, let me see a couple of other questions. Okay, so Edward had posted a question that I said, I was asking what are some of the challenges the patient posed on nurses? Oh, okay. Sister Agnes, this one is good for you. What are some of the challenges you face from your patients?
Okay. I'm working on the dementia unit.
Okay.
And so the dementia unit, some of the challenges we face is elopement. When we say elopement, some of the patient just wants to go home. So if you're not careful, he enters the elevator, he's gone. So we call this place a closed unit.
Okay.
You need to monitor to make sure everybody is here. When you get here, you check the census is 24. You got to make sure that you go around and make sure that your census is 24. Everybody is here. Because some of them walk around. I'm going to work. I'm going to move my car. You know, this when they were young, they are used to that.
Yeah.
And so that is what they want to do.
Yeah.
And so, yeah, and some of them too, when the dementia progresses, oh, bastard, you know, I'm sorry to use that word, but that is what they will insult you. Yeah. Somebody just used the F word on me right now. And I said, thank you. And so, yes, these are some of it. But if you know, when you get here, they will train you. So if you know the kind of patients you are dealing with, you don't take it personal.
That's right.
You don't take it personal. So these are some of the challenges. Just like if you're a nurse in Ghana, some of the patients will insult you. The same thing here. So, yeah.
Okay.
Have I answered the question? Have I answered it?
Yes, 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 yes. So Richardson, I've always been reading the NCLEX book because I am a nurse in Ghana. But I think the focus now is the CNA certification. Should I stop the NCLEX book and read the nursing assistant books and prepare for the NCLEX when I get to the US? Richardson, if you are on our program, I think we have explained all these. When you start our program, you have a choice between the NCLEX or the CNA. In fact, CNA start as caregivers or the caregiving program. Then when you finish your interview, you pass, you place you on the CNA program. But those with the ability to do the NCLEX and we normally focus on BSN, those with the degree in nursing. If they so choose, we let them to do the NCLEX. So if you have a degree in nursing, you have gone through the prerequisite requirement and you are reading your NCLEX book, please stay on the NCLEX, focus. Otherwise, the CNA is the other option. All right. I think we have answered almost all the questions in the chat box. I don't see any other question. Rosemary, your hand is still up. Do you still have any questions? Okay.
Rosemary Amoah. Amoah was my grandmother's name. I love the name.
Oh, and, I see.
Yes, and then my cousin would say, yeah, that's my mom's name, and so I don't add the H to it. So when I saw Amoah, I'm like, no H. That's my grandmother's name. Yeah.
Oh, the H, they made a mistake, so I'm used to the H.
Oh, over here there's no H, yeah, and so
yeah, so I've taken it like that, but there's no H actually.
Yeah, that's good. That's my grandmother's name.
Oh, okay.
All right.
Oh, please, there's no question again. Just I forgot to. Yeah,
okay,
thank you.
You're welcome. All right.
Okay.
On that note, we thank you all. Agnes, do you have anything more to say?
Yeah, I just want to say one thing. That is my little piece of advice. what I want to say is, if you want to come here, this is from me. You can take it or leave it. You can come as a CNA, and then over here, you no matter your level, you can come as a CNA. And when you come here, you educate yourself. You go back. Like I keep saying, education here is there. It's always open, no matter your age, no matter how many years you want to take. And so I would just say that, please, if you want to come, you can come as a certified nursing assistant and upgrade yourself here. You have all the degrees home. Then you come here, you work on it, and then become whoever you want to be, a registered nurse, an LPN, a BSN in nursing. But the best option is just start with the CNA first, because things are different here. You are a nurse in Ghana. When you come here, still there's a lot of differences. So please take that. You can take it or leave it. And also, I'll be very happy to meet you all here from my country. I'll be proud to see my people here and work with you. So God bless you all and good luck. Thank you.
God bless you. God bless you. Yes,
God
very
bless
true. Yes.
you. God bless you.
Esther, your last question was.
Yamishiro.
Once Yamishiro, Papa,
Amen.
Yami Edia Bray. First, and I went Chile, say, I buy a fee. It's a quana beda holder, and Yakasa Yensono, ye bedi, Nasam Sona, a beba, ye fear.
We want to be there. We want to be there.
Yes, and I want to see you all. I want to see you all. Thank you. God bless you.
All right. So there's one last question.
Okay.
Sama answer. Friends, Lamte Mills in the question and a Hunton. With your program, do you sponsor the NCLEX? Yes, we sponsor the NCLEX.
Yes.
So we said with the preparation for the NCLEX, is your agency going to sponsor us on that? Yes, we do.
Yes.
But there are fees you will also pay. And then somebody asked, how many months will it take for us to complete this process? Comfort, you have a meeting tomorrow, 6 p.m. Come, those questions will be answered. All right. Thank you all for coming. We are grateful to you. Agnes, thank you so much. God bless you. That's a papa.
Thank you. Thank you.
US. Thank you.
Yes, yeah, will be a Mabusha Fonina, Latte, Accra, everywhere. Okay.
All right.
Bye-bye.
Bye-bye. Bye-bye.